Did you know the average cost of essential medical equipment is around 50,000 a year and most insurance covers only a fraction of that? Tell me a little bit more about that because that's a number I did not realize.
Well, just to put it into perspective, a patient with a spinal cord injury or MS or Parkinson's disease, ALS, the type of power wheelchair that they need is 35,000 average. If it needs more customization, it can be more than that. And what most people don't recognize is insurance doesn't typically pay for all of that, especially if patients are older and only have Medicare, they still have to come up with that 20%. So that's still $7,000 that they have to come up with out of their pocket to be able to have just that one piece of equipment, much less bathroom modifications, widened doorways, ramps up to their house, all of those types of things.
So, this number, most people never really think about, I imagine, until it affects someone they love. You've seen this reality firsthand. Can you tell me a little bit about what inspired you to create the Carl Edward Foundation?
Absolutely. So my uncle was Carl Edward. He passed away this past December of 2024. He was injured at 19 and ended up a patient with paraplegia. So his lower extremities were paralyzed from the age of 19. And he lived almost 55 years with a spinal cord injury. So, over the lifetime of someone with a spinal cord injury at that young of an age, it's $4 million of cost of care. So, that's home modifications, that's hospitalizations, that's equipment, that's everything that happens in their life that is a result of having that injury. And I watched my uncle work for many, many years until he no longer could. And many patients with spinal cord injury, my uncle included, continued to push himself in a manual wheelchair much longer than his shoulders really would allow because of the cost that comes with transitioning to a power wheelchair. The power wheelchair that he needed in particular was $35,000. When he was no longer able to work, he was making $1,600 a month with Medicare only. 20% of that is him coming up with $7,000 for that wheelchair. Now, the other side of that is you need either a lift on the back of your truck or van to carry that wheelchair, or a wheelchair accessible van, which can be an additional cost of anywhere between $50 and $100,000. And most people, when I tell them these numbers, they're like, doesn't insurance cover that? And most of the time, the answer is no, or insurance covers a portion of the equipment that's needed, but not all of the equipment. I can't tell you how often I've told my patients, I'm not an insurance expert, and you likely want them to pay for the most expensive thing. And then we figure out grants, community assistance, other opportunities to get the other pieces of equipment that you need, because oftentimes there's denials or questions as to whether you really need all of this equipment.
And so, what you describe is what the Carl Edwards Foundation enables for people with spinal cord injuries or neurological diseases that need this essential medical equipment to be able to have that without straining their finances. And then we're not even talking about just everyday things that are needed. We're
Right.
talking about one component of daily life. And
Right.
so I wanted to find out, for those who may not know, what are examples of neurological diseases?
Yeah, absolutely. So think of things like multiple sclerosis and Parkinson's disease, ALS, and then you're a little bit more rare. There's like progressive supranuclear palsy. uh, And then there's also PLS. Like there's so many. And then, of course, you also have your levels of dementia and Alzheimer's disease that then also come with physical mobility deficits as the dementia progresses. So you may not personally be affected by a spinal cord injury, but you may know somebody. Think Paralympians. I've had patients for years with Parkinson's disease. So mobility in general declines obviously as we age, but then you add this neurological component that can affect your respiratory function, it can affect your cardiac function, it can affect your GI function. And these are things that most people just don't know. I can't tell you how many times my uncle, like as a small child, before I was a physical therapist, people would say, "Oh, well, your uncle just can't walk, right?" And it's so much more than that. There's sensation loss, there's loss of function of so many things that people just, if you don't know, you don't know. And that's fine. There's no judgment there. But my goal really is to have people be more aware of what these patients go through and also recognize the cost that now can potentially like upend their life. I will never forget my uncle saying, "Don't ever think that they won't come after your house when you can't pay your medical bills." So, these patients fight real battles of bankruptcy and foreclosure if these things aren't met in other ways.
Yeah, thank you for really taking us behind the scenes of different things that we may not think of that affect everyday life, and there's so many different components if you're not knowing what's going on behind the scenes, and that's why the Bridge the Gap event is so important, not only, of course, to be able to raise funds to help individuals and their families, but the awareness piece. You've just given information that I was not aware of, all of the different numbers and what this all looks like in real time. And you wouldn't unless it affects someone, yourself, or someone that's close to you. Can you tell me a little bit about the Bridge the Gap event on November 5th and
Absolutely.
what it enables?
Our biggest goal is to allow every person access to dignity. So many of us want to continue to do things for ourselves for as long as we can with independence and freedom. So for me, it's hope. It's giving people the freedom of safety and accessibility to continue their activities of daily living, to continue to go to work, to continue to participate in the community. And the Cliff House at Pikes Peak in Manitou Springs has offered their event space for us. It's going to be on November 5th from 5 to 8. And our big goal is awareness, but also to raise funds to allow all of these different beautiful people to continue to participate in their life, in their community, go out with their grandkids. And even my uncle, when he first was injured, he played wheelchair basketball. He did wheelchair races. So to also recognize your life isn't over with this new diagnosis, it's just different. So we're going to have some incredible speakers, some equipment there, but really, I can still do life. I can still do all of my life. It's just different now.
Oh, I love that. For those of you who are in the area, uh, you know, go if you can.
Yes, we would
Tell a
love to have
friend.
you.
And for those who may want to be able to enable something for someone's life, families in real time, there is an option as well to be able to donate. What other areas are you all still taking sponsorships?
Yeah, absolutely.
And how do they find out about that? Do they go to the donation website or do they reach out to you personally?
Either one is fine. If you want to donate, you can reach out to me. But there is on the link that's in the comments, when you go to buy tickets, all of the levels of sponsorship are there and the opportunity to donate is there as well if you can't attend the event.
Awesome. Thank you so much, Corey, for what you are doing, what your team is doing. I imagine your uncle is so proud of you. And so what a beautiful way to honor his legacy as well.
Thank you so much for having me on today.
You're welcome.